Okay, good evening to all of you. So I take this opportunity on this World Heart Day to introduce myself first and then to actually take you through to the knowledge about the heart disease and how actually we can take all the measures to prevent the heart disease. So I am Dr. Rajneesh Kapoor. I'm interventional cardiology at Medanta, the Medicity, Vice Chairman Interventional Cardiology at Medanta, the Medicity. And it's an honor for me that I'm invited here to give this talk here. In fact, this is an interactive platform. That's what I have been told. And once again, good evening to all of you. And I'm quite hopeful that this is going to be a highly productive session where I'm going to talk about why the incidence of heart disease or heart attacks or deaths because of heart attacks are going very high in young individuals, which has been really a talk of the town in the last 6 months or so. And then how we can take various steps to prevent the heart disease. So I have been asked many questions repeatedly based on which okay. So as I was mentioning, usually many common questions are asked to us. As a cardiologist, the first question usually comes is that how do cardiovascular diseases affect our health, and why is cardiovascular disease a global health concern? To answer this, I would give a statement that cardiovascular disease and mortality because of cardiovascular disease is the biggest killer in the world, much more than accidental deaths, much more than cancer deaths also. So it's the biggest killer in the world. So that is where the concerns and the scare is very high. So we have to be cautious in actually picking up the heart disease at the earliest and also taking all the precautionary steps so that we can prevent all the heart disease. Why? Because simply if a heart attack happens, there is a damage to the heart muscle, and that damage to the heart muscle leads to a decreased efficiency of the heart. So what it actually translates into, so decreased efficiency of the heart leads to a lot of breathing discomforts. The quality of life of that person is totally impacted. He's not able to do all the ordinary activities like taking a bath or having a shirt or changing clothes. All these common things become a high point, and usually patient is not able to do so without a big breathing discomfort. That is where it is very, very important to pick and choose the heart disease at an earlier stage before it hits, before it damages the heart. And also, as we have seen, in many circumstances, the first heart attack can be lethal. It can actually mean a loss of life. It's really shocking. And the biggest examples which we have seen in last 6 months is recent was the Raju Srivastava's death. Now, Raju Srivastava was 56, 58-year-old guy, not a highly aged guy, I mean, moderate, and he was actually gymming. He was doing exercise in some of the gym where he had some discomfort and he had a massive heart attack. He was close to All India Institute. He reached All India Institute promptly, but even that response couldn't salvage him. So this is the gravity of a heart problem. This is the intensity, what it can lead to. It can lead to a loss of life. And still there are many examples. There is another example of our singer, versatile singer KK. He was doing some concert. He had some acidity-like symptoms. He was not feeling comfortable, which was visible in news channels. So he just ignored these symptoms for maybe 15 minutes to half an hour. And then opportunity was further missed where he was not taken swiftly to a hospital. He was taken to a hotel, and from there, once he reached a hospital, he was not into a salvageable state. So another life lost. There is another example. There is another Bollywood actor, Siddharth Shukla. He had again some discomfort or acidity like symptoms at night, he ignored, and in the morning, he was again dead. So, what I'm trying to say and put emphasis on is there could be small or minute symptoms like acidity like symptoms where some burning is there or some sweating is there. Please do not ignore these, especially those individuals who have risk factors for heart disease, who have high blood pressure, who have diabetes, who are smokers, and who actually have a positive family history of heart disease in their family tree. Do not ignore these symptoms which look minimal, which mimic like acidity like symptoms. And usually, the biggest foolishness, the biggest mistake people do, they attribute these symptoms to some erratic eating the previous night. 30% of heart attacks, they usually remain silent or they have only such minimal symptoms. A simple ECG done at that stage where patient is having these minimal symptoms can rule out a heart attack and it can save a life. So this is a big message which I want to convey through this platform, that any person who's a smoker who has risk factors for heart disease, if these symptoms happen for and it is happening for more than 10 minutes or so, some discomfort, do not ignore this, get a ECG done. Even if one has to do multiple ECGs, that's fine, but we have to save a life. There are a few more questions asked to us. Why is the rate of heart attacks is increasing in young people? Now, this is again very important. This is where our whole uh, discussion and whole interaction or my talk is going in that direction. Why young people more? Now, if I tell you the way we used to practice 10 years back, we used to have heart attacks, many heart attacks, but the average age of a person who was landing with a heart attack in our emergency department was 55 to 60 years minimum. Now that average age has gone down to 35 to 40 years. This is a very big concern. This is really shocking. Why? I tell you. I have digged deep into this and I know. See, what is happening, our young generation is highly ambitious. I am not saying being ambitious is bad. One should be ambitious, one should set their targets high, but then to follow that path, to follow that trajectory to achieve those targets, one should set up a time frame also. So there are certain targets which should be achieved in 2 years. Now, if somebody starts to chase those targets within 2 months, that is a bad news. That is where the stress levels actually accumulate and go very high, go out of control, and that imbalance leads to a lot of hormonal imbalance in the body. The sympathetic system, the catecholamines, those hormones, they go very high in the body, and those are deleterious to the heart. Person becomes highly vulnerable to heart attacks or heart disease because of this imbalance, and also because of over ambitious attitude. Many young individuals are taking the help of or the support of smoking as a stress buster. This is again very bad. At times, there is a drug intake also. So these things are really highly distressed, and one should take care of not to be in trap of these things. Be proactive, be aggressive. Thinking of a good life with more ambitions is good, but then you should have a peace of mind and a calm attitude to chase those targets and achieve those targets. Do not go, do not get deviated out of the way. That will lead to a bad health and more risk for the heart. So this is why I think our young population is more at a risk of heart attacks. Another question usually asked, and it is given to me as a questionnaire, is how come our cardiovascular problems after COVID-19, how common are, and how to improve our heart health after recovering from pandemic? This is again highly important and needs a discussion here that COVID pandemic was a really a time zone where we struggled a lot. Our whole nation struggled a lot, and we as doctors were the actually front runners of getting these infections, and still we had a lot of grit to defeat this pandemic, and successfully we have come out of this pandemic. I remember those times once we used to take rounds of ICUs which were full with COVID patients. It was actually a nightmare. But the question relates to the heart health in COVID. So, what actually COVID was doing? The heart problems were really common. COVID is a prothrombotic state. It leads to more chances of clot formation in the body. So that clot formation can happen inside the arteries of the heart, also leading to multiple heart attacks. And we got numerous heart attacks in COVID infection time. And we treated all those by opening those arteries and removing those clot from the coronary arteries. Post COVID also, persons remain vulnerable for heart problems like myocarditis or arrhythmias. We had many patients, so one has to be careful even in the post-COVID state. COVID has disappeared, but 6 months after COVID, these things can happen. So do not ignore such symptoms like palpitations, like loss of consciousness, transient loss of consciousness, and a breathing discomfort post-COVID. It can be a marker for a heart disease. Get yourself checked. And the checkup is not complicated. It requires only a small test called echocardiogram to test your heart function and the structure of the heart. So this is about a COVID and a post-COVID phenomena. So now another question usually is asked. Now, if somebody gets a heart attack in a public area, what to do? How to manage it best so that we can salvage a life? So if somebody gets a chest pain, severe chest pain with sweating, it could be a heart attack in a public area. Please be absolutely cautious. Please be absolutely vigilant. So, one, without wasting any time, one should think of getting a ECG done in that patient. So either if the patient is absolutely conscious, although having a chest pain, he should call in for an ambulance or go to a nearby doctor where ECG can be done. ECG will decide whether this is acute massive heart attack or not. If it is acute massive heart attack, the next thing which should come to everybody's mind is get this patient to a facility where a cardiac cath lab is there, where angioplasty can be done to open this culprit artery which is causing a heart attack immediately. So if we can achieve these opening of such arteries within 6 hours of onset of heart attack, we can actually have the best outcomes in terms of that heart muscle remains healthy and there is no damage done to the heart muscle, and we can salvage a life. And then even the grave situation is if somebody collapses in the public area. Now that is a separate zone altogether. Now most of the collapses, if person is not breathing and there is no pulse, so basically it is taken as a sudden cardiac arrest. If sudden cardiac arrest happens in a public area, then what should we do to salvage a life? Because this is not like a heart attack. Heart attack gives a person still a time, but a sudden cardiac arrest requires attention immediately. So the nearby persons who are in the vicinity, they should act fast. They should actually do the CPR. CPR is a cardiopulmonary resuscitation where chest compressions are done. So anybody should start the chest compression and simultaneously ask for an ambulance to shift this patient to a hospital. This is the only possible method by which you can salvage a life. Otherwise, the life will be lost in next 2 to 5 minutes. And I tell you, giving a adequate CPR out of this subset who gets a sudden cardiac arrest outside the hospital, still 20 to 30% can be salvaged if a good adequate CPR is given to this patient and simultaneously he is shifted to a hospital. So these are some of the important tips, but most important tip still remains is how to prevent a heart attack, because treatment wise We have all the infrastructure, all the beautiful hospitals and doctors with beautiful expertise and intellect available to do all these procedures on a patient who lands up in a hospital. But we cannot imagine a scenario where if the heart attacks are growing exponentially at the same rate where they are growing now, then do we have an infrastructure to treat all patients? No, we don't have. So the best way we can handle this crisis of increasing heart problem is prevention of heart disease. So how we can prevent it? The best ways are lifestyle modification. So lifestyle modification constitutes our dietary changes and some of the changes which are relating to exercise, and then stress management and a good adequate sleep. So these are some of the lifestyle changes. Dietary changes: one should restrict the high amount of carbohydrates in the diet. One should restrict the bad fats, the trans fats, and the saturated fats. One should restrict those in the diet. One should have a better protein intake in the diet rather than replacing these saturated fats and carbohydrates. So these are the important broad tips. Then exercise as much as possible, 5 to 6 days a week for 30 to 40 minutes is considered a very good level of exercise. Brisk walking, jogging, treadmilling, swimming, any kind of cardio exercise is considered good. Stress management is again very important. We started with why a heart disease is rampant in young individuals. The reason is because of high amount of stress in that community these days. So stress management is very important. Be very logical, be very organized, and talk your problems. Discuss your problems with your family and friends. This is a way to manage your stress. No smoking, no alcohol, or just in moderation, but there is no scope of smoking in your life. Smoking is a poison. So, and then a good adequate sleep. Deprivation of sleep is considered a newer trigger factor for heart disease, heart attacks. If somebody is sleeping less than 6 hours in 24 hours, this is considered as a newer risk factor. So a good amount of sleep, 6 to 7 hours at least per 24 hours is must. So if we take care of these few points, I think we can prevent a heart disease in a big way, and then we don't require a cardiologist or the hospitals. Screening should be done in those patients more than 45 years of age annually. They should spend 1 day in 1 year for their cardiac screening. This is also very important to pick up the heart disease at an earlier point. And if we pick up the heart disease at an earlier point, we can actually have the better outcomes. So this is the message coming out of this whole discussion. Manage your life well, have a good, healthy heart. If you have a good, healthy heart within your body, I think you can enjoy the things worldly, in your vicinity, your family, in a best possible manner. Take care of yourself. Thank you.